So, without further delay, I will now introduce the first speaker. The first speaker is Dr. Marina Maggini. Dr. Maggini is a senior epidemiologist at Italian National Institute of Health. She led the National Diabetes Disease Management Project and the National Project on Chronic Diseases in collaboration with the Italian Ministry of Health. From 2014 to 2017, she led the work package Diabetes, a case study on strengthening healthcare for people with chronic diseases within the European Joint Action on Chronic Diseases. Dr. Maggini, it's a pleasure, and now we are anxious to hear you.
Thank you very much. It's really a pleasure to have the opportunity to meet you, and even if offline, and to share you the experiences and the results of the joint action, both CHRODIS and CHRODIS Plus, the two joint action. And of course, I want to share also with you my screen. I will try. Sorry. Okay, you can see my
yes.
The slides. Okay, good. So as I said, it's really a pleasure for me, and as for Jelka that give the presentation in the last seminar, because it's really important for us, after all the work that we did in this two joint action, to have the possibility to present the result, so as other people, other health professionals and researchers in other countries can use the results of this of the work that we did. The main result of our work is the definition of a guide for the implementation of good practices based on results of the two joint actions, and the result of the work done from 8 countries using CHRODIS recommendations and criteria in CHRODIS Plus. So results and lessons from learned in diabetes field were used to foster implementation of high quality care for people with chronic diseases. In particular, to encourage the adoption and implementation of CHRODIS quality criteria and recommendations, QCR, and the evaluation of the applicability and transferability of QCR across countries. The goal of CHRODIS, the first joint action, was to address the practices and policies related to chronic disease in Europe and to promote and facilitate a process of exchange and transfer of good practices on chronic conditions among European countries. The final objective was to pave the way for better health policies and interventions to improve the well-being of citizens. The focus was on health promotion and chronic disease prevention of multimorbidity and diabetes. Diabetes was, in the frame of CHRODIS, was considered a case study on strengthening healthcare for people with chronic diseases. Diabetes can be taken as a tracer condition to demonstrate the importance of holistic approach to the prevention and treatment of chronic diseases. The work package on diabetes was focused on prevention and promotion, comprehensive and multifactorial and interdisciplinary care, educational strategies for people with diabetes, and training for health professionals. Specific objectives were to improve coordination and cooperation among member states to act on diabetes, including the exchange of good practices, the definition of quality criteria recommendations to improve prevention and quality of care for people with diabetes, and the definition of a guide for national diabetes plan. We had a great opportunity with the joint action CHRODIS Plus to build on past knowledge and activities conducted on CHRODIS to help addressing the challenge of chronic diseases. European member states employ a wealth of models and policies on effective and efficient way to prevent and manage chronic diseases. By making a better use of this knowledge, there is significant potential for reducing the burden of these diseases. CHRODIS Plus actively contributed, we hope, to sharing these various models and policies. The main objective of our work package, fostering the quality of care for people with chronic diseases, was the evaluation of the applicability and transferability of the quality criteria recommendations defined in CHRODIS across countries to contribute at improving the quality of care for people with chronic diseases. But what are QCR? What are the quality criteria recommendations? QCR is essentially a set of quality criteria, a sort of checklist to assess whether a practice, an intervention, policy, strategies, and so on, can be regarded as a good practice using type 2 diabetes as a model, as an example disease. An extensive process was carried out following a sound methodology from systematic literature review to Delphi consultation. QCR definition involved the community of partners of CHRODIS, but also experts from a wide number of organizations across Europe and from a variety of professional backgrounds, including, of course, patients and representative of patients. The result is, as I said, a tool which may be effectively used in policy making. The process led to the agreement of 9 core quality criteria, from designing of the practice to the evaluation of sustainability and scalability, including the empowerment of the target population, initiative of education and training, and taking into account ethical issues. Here you can see a visual representation of this framework, this checklist in the form of a flower. These criteria were the basis, these 9 criteria were the basis to formulate 9 recommendations to implement, monitor, and evaluate practices to improve prevention and quality of care for people with diabetes, but general enough to be applied to all chronic diseases. As an example, this is the recommendation on practice design. So the quality criteria is design the practice. The recommendation is the design should clearly specify aims, objectives, and methods, and so on. So the recommendation specifies the essential component of this activity. All these, as I said, all these criteria and also the wording of the recommendations were defined through a Delphi procedure. So it was, they were agreed among the expert panel. These recommendations are general enough to be applied, even if they are developed for diabetes, they are general enough to be applied to any of the chronic diseases and can be implemented all across European countries, irrespective of political, administrative, social, and healthcare organization. Moreover, QCR may be applied to various domains, for example, prevention, care, health promotion, education and training. QCR constitute also a tool for decision makers, healthcare providers, healthcare personnel, and patients to improve and support implementation of good practices. In CHRODIS Plus, 8 European partners from Bulgaria, Croatia, Finland, Germany, Greece, Spain, Serbia, and Slovenia planned and conducted pilot actions to implement and test QCR in different settings and contexts for practice design, development, implementation, monitoring, and evaluation. So different use in the different countries. Each participating country followed the same methodology to carry on the pilot action, a methodology that was previously defined and agreed among implementers. And this methodology is reported in a sort of guide, a blueprint for action that can be seen in the website of the work package. The partners used qualitative and quantitative methods for data analysis to assess the effectiveness both of the pilot action and QCR. QCR usability was tested and evaluated in a project designed and carried on in different healthcare systems, in different contexts, and addressing different scopes, and mostly resulted in implementation of complex changes in healthcare. There was a consensus, fortunately, among implementers that the QCR was a positive framework which supported their projects, also establishing a high level of involvement of target population, showing a great potential for sustainability and scalability. Based on the practical experience of the 8 pilot action, it was possible to define a guide that outlines the steps for a successful translation of into practice of the QCR. This is a visual representation of these 7 steps. The first one of the step is the establishment of the core leadership group and the implementation working group. Various aspects of governance and leadership have to be addressed prior to design the practice and to establish a wider group responsible for its implementation. Target population participation is, of course, a key aspect. The second step is to define the scope of the practice. The implementation working group, led by the core leadership group, defines problem, general purpose, target population, selecting core elements of the practice. It's necessary a starting point to perform a baseline analysis of situation and context to identify factors that might affect the implementation, and the analysis of the baseline and the context may be conducted using quantitative, qualitative, or mixed methodology. The following step is to design of pilot action plan, defining, of course, specific objectives, activities, responsibilities, timeline, and the key performance indicators. Monitoring and evaluation of the implementation is a crucial step to encourage continuous learning, improvement, and, if necessary, to further reshape the practice. In CHRODIS Plus, the partners use the PDSA approach, Plan, Do, Study, Act approach. Reporting of the result is also a crucial point to convey core information and messages to the scientific, professional, and lay community, as well as to decision makers. And these are essential elements for sustainability and scalability. Planning for sustainability of the practice and to increase the potential for scale up is the last point, the last of the 7 steps, but it should be considered from the first day of the activity. Sustainability of the practice can be ensured through institutional commitment, ownership, broad support by the relevant stakeholders, interested parties, and communities. A valuable learning point is that all implementation working groups consider QCR tool as a trusted source of strategy and procedures when it comes to the design, development, and implementation of practices and activities into their respective sites, highlighting that implementing change is most effective when aligned with local priorities. The guide for implementation of QCR provides additional practical support to all of those who want to develop, implement, monitor, and evaluate good practices. A striking characteristics of the implementation projects has been the enthusiasm and hard work observed at all of the sites that collaborated to the joint action, and the willingness of stakeholders, the professional decision makers, patients, and so on, to cooperate and share their own experience with other groups, learning from the experience of other countries. Partners themselves represent a knowledge hub and a network with hands-on expertise in improving prevention and care of chronic diseases. Sharing and discussing experiences is an efficient means to set up a capital of knowledge that can also be used in the future. The added value is represented by the creation of a network, of a community, a transnational human capital that doesn't end with the end of this specific project. All the documents, papers, newsletter, presentation can be viewed and downloaded by the CHRODIS website. And I must say that it would be fantastic if our work could add at least one step toward changing the quality of care for people with diabetes and chronic disease in general. And so please browse the site and use the results. Thank you very much for your attention.